The endometrial cancer is the second most frequently cancer in the female population after the breast cancer treatment. So, the treatment of all the types of endometrial cancer in first time is the surgery, radical surgery, which is a radical hysterectomy. And after that is indicated the adjuvant treatment. The indications for adjuvant treatment is according to study or risk factors. So risk factors, they are very important for the prescribed to adequate adjuvant treatment because main randomized trials demonstrated that in early stage adenocarcinoma, in the low risk is not indicated any adjuvant treatment because before they used a lot radiotherapy treatment, the pelvic radiotherapy, but was demonstrated that this type of treatment increase a lot light toxicity and quality of life of the patients. And the actual recommendations is for the early stage adenocarcinoma, stage 1A, the low risk, nothing, no adjuvant treatment. And what about the intermediate risk of endometrial carcinoma is also very, very interesting because before also they applied radiotherapy or in some case chemotherapy. But now demonstrated that in the intermediate risk adenocarcinoma, most used treatment is just vaginal brachytherapy. But it was conducted a very interesting trial also and by gynecology oncology group, a trial number 249, and the trial compared two types of treatment, vaginal brachytherapy plus chemotherapy and pelvic radiotherapy. And this trial demonstrates that pelvic radiotherapy is most effective, that vaginal brachytherapy plus chemotherapy, but just in high-risk adenocarcinoma, but in no intermediate or low risk. So now actually the standard adjuvant treatment for endometrial carcinoma is the low risk, nothing, just observation, intermediate risk, considered observation or vaginal brachytherapy, and high intermediate risk, according to stages also, vaginal brachytherapy or pelvic radiotherapy plus chemotherapy. It depends on the risk factors and also the stage. In high-risk adenocarcinoma, the most useful treatment is pelvic radiotherapy. But high-risk endometrial carcinoma stage 3, including stage 3A, B, C, pelvic radiotherapy plus chemotherapy. Yes, but upcoming trials now is a PORTEC 4 trial. This is open trial, but this trial will be conducted to investigate to genomic specifications. For the next trials, will be determined the genomic characteristic of the endometrial carcinoma and the choice, any treatment regarding to genomic characteristic, also the risk factors. Yes, of course, because it's very important, the collaboration between oncologists, medical oncologists, radiotherapy oncologists, also surgical oncologists. And we always are together and analyze each patient, and we choose the correct treatment for each patient individually.